Welcome to my father's show, ColdLaser.tv.
Hi, my name is Dr. Todd Austin. I'm coming to you from Austin Family Chiropractic in Virden, Illinois. And actually, today I'm coming to you from the Cold Laser TV studio. And welcome to this episode of ColdLaser.tv. So today we're going to talk about the medicine cabinet of the 21st century and how that relates to cold laser therapy. Well, if you really think about it, a lot of people are on a lot of drugs that they really don't need to be on. There's a push in the pharmaceutical industry and in the medical community here in the year 2012 to get every single man, woman, and child on a statin drug, to get as many people as possible on heart disease drugs, blood pressure drugs, antidepressants, diabetic drugs, etc., etc. Now, as a chiropractor, I'm not anti-drug, but I'm anti the abuse of drugs. So one of my goals as a chiropractic physician, as a holistic healthcare provider, and as a cold laser therapist is to try to get patients, basically, if we can't get them off of drugs altogether, then it's to get them on as few drugs as possible and only have them on the ones that they actually need to be taking. So if we look at what the medicine cabinet may look like in the 21st century, later in the 21st century, of course now we're in the year 2012, so let's say we're looking at the year 2020, for example. Well, we're going to find that most people will be doing pretty much the way I'm leading my life right now, which is I take 0 daily medications. I take quite a few supplements. I take supplements for heart health, for example, coenzyme Q10. I take vitamin E with mixed tocopherols, and I take fish oils, omega-3 fish oils for heart health. If you're a male that has a family history of prostate issues, you should be taking things like saw palmetto and stinging nettle root, which are herbs. If you're a person that has a personal history of eye disorders, you should be taking a supplement that has bilberry in it and a lot of phytonutrients and antioxidants for eye health, etc., etc. So there's a lot of different options of things that we should be taking other than just reaching for pills. Now, I got the idea for this topic because I was listening to a laser salesperson, actually looked at a laser advertisement that I got in the email recently from a laser salesperson with the $14,000 Whistles and Bells laser company that I referred to quite often in earlier videos. And this doctor said the household of the future will have a cold laser therapy device in your medicine cabinet. And that makes perfect sense. Now, the only difference was this guy was trying to sell everyone a cold laser therapy device that obviously cost $14,000. And his cold laser therapy device does have some FDA approvals and all that. That's probably one of the reasons that it costs so much. The price has come down a little on this doctor's product that he hawks, and it is now $12,000. But obviously, way too much money for the average person to afford. And of course, we have a laser that we carry here at Austin Family Chiropractic, and it does the same things as this $12,000 laser, and it is only $30. Has the same exact laser diode and everything. So that would definitely be something that would be useful in the medicine cabinet of today and in the future as we move farther into the 21st century. Now, another laser that I recently got wind of, found out about, did my homework on, and actually started carrying is one that we call the PainBeGone LASER. And it is also a very affordable option that could definitely be in the medicine cabinet of the present and the future here in the 21st century. And it is called the PainBeGone laser. This laser actually has a depth of penetration of 5 centimeters. It has an FDA approval for treatment of pain associated with musculoskeletal origin. So how it works. Okay, so we have visible red combined with infrared in this laser device, and we can see how that works. So these would definitely be two good solid options for the 21st century medicine cabinet of the future. So like I said, we're going to try to get rid of as many drugs as possible. We're going to try to replace those with natural substances such as multivitamins, vitamins and minerals, herbs, standardized extracts of herbs, things like that. Now, if you want more information on these other things that should be in the 21st century medicine cabinet, please feel free to go to my YouTube channel, where I have more than just my coldlaser.tv videos. I have my chiropractic videos, I have my health-related videos. Another thing I forgot to mention that would be in that sinus cabinet would be the NeoMed Sinus Rinse Kit, and a special ingredient that I use with that as well in the sinus rinse to keep us off all the sinus medications and the allergy medications that most of us, once again, really do not need, if truth be known. So you can go to my YouTube site, which is youtube.com/Todd Austin DC, and that will take you to the rest of my videos. I have over 50 videos in all on my YouTube site, so please feel free to check those out. But like I said, medicine cabinet of the future, sorry for that other doctor with the $12,000 whistles and bells laser. Most people cannot afford that in their medicine cabinet of the future, but they have a much greater chance, much greater likelihood of being able to afford a $30 laser that penetrates the same 1 centimeter deep as your $12,000 one does, and they have a much better chance of being able to combine that with a laser, the PainBeGone laser, which sells for currently less than $700. So something not every family can afford, but I'm sure many of you can, and that's just something that we recommend for the medicine cabinet of the future. So you would have a laser then that penetrates 1 centimeter deep, which could, handle superficial things, things like cuts, scrapes, things like that. And then you have the one that penetrates 5 centimeters deep, which will be really a great laser for pain, and like I said, FDA approved for the purposes of pain. So if we have a deep shoulder problem, or we have a deep knee problem, a deep low back issue, the PainBeGone laser is going to be a pretty nice tool to have in the medicine cabinet for that. So I hope I've given you some ideas about what might be in your medicine cabinet of the future as we move forward into the 21st century. And if you have any questions, feel free to contact me. My email is below, draustin@royal.net, and I look forward to having you join me on future episodes of coldlaser.tv. Thank you, and have a terrific day.